Hey guys, this is my first ever video, so please bear with me. I'm not really sure how to use all of this stuff, but this video is intended to help show you guys how to make high yield pathology flashcards. I want to start off first by saying that you guys are all awesome. Thanks so much for contributing, wanting to share your love of pathology with others. I know that it'll be greatly appreciated by me and everyone else who will be able to see your creations. So thanks again for agreeing to help with this. So this video is going to go over kind of how to use Google Slides, which is what this program is, how to make a copy of this template that I'm going to give you guys, how to edit it, including changing text, adding photos, and changing the slides or layout of things. And then once you're finished, how exactly to share that with me so that I can post it on the website. So before we get started, anytime that you guys are going to be making a flashcard, please make a copy of the template that I send. Do not edit the template because everybody's going to be continuing to use this, and I may update the template from time to time, so whenever you're going to start a new flashcard, just start from the template instead of your own template. So the way to do this is that you click on here, File, and then just make a copy, and then you can make it and save it to your own drive, and then it'll open up in a new document, and then you're good to go. So that's how you make a copy. Now, how to edit it, this is basically just like PowerPoint. So if you guys know how to use PowerPoint, you guys should know how to use Google Slides and any of the Google document stuff with no problem. The first couple of slides that I'm going to have in the flashcard file should basically be applicable to every kind of disease process that's out there, so please try to include those first couple of slides, but then after that it's completely up to you what you want to include or how you want to design something. So let's get started with that. Here's like the first slide. All you do is you click on it and then say title, and then this is where you add your author's name. Oops, if I could type. Authors. So then that's just how you get started editing. They're very easy. Click and push next. So standard information that should be included in basically every flashcard would be just some general information about the disease, some epidemiology or statistic types things, clinical correlation, including like how a typical person would present, their prognosis, whether it's really aggressive or something like that, treatment options that pathologists particularly should be aware of. Like if you say something's benign, that means that they may not get an important surgery, so things like that. Also include any high yield imaging or lab findings that maybe should be correlated with or could really point to a specific diagnosis. If you have a gross photo of the entity, then that's always good. The big thing for pathologists particularly are the histologic findings. So some good histology on H&E or your stains, anything that can be helpful there. And then any ancillary studies, which would include your IHC or special stains and molecular or cytogenetic stuff. So like I said, try to be complete as possible, but I realize that not everything's going to have or like, kind of fit into this cookie cutter categories. So, take liberty with your own creation process. So here's one of those first slides that I think everybody should kind of include in these flashcards. So like I said, all you have to do is just click and then title up here, general information. This would be kind of where you put a very big overview or a summary of the high yield findings, things that are really big clues to kind of helping you make a diagnosis. Some entities have other names or used to be called something else, so this would be the place to kind of put that. Basically anything that will help you to call this entity. And if there's any syndromic associations, this might be a good place to put it as well, because some diseases would occur with others. Then here in this epidemiology portion, I have this is basically static. So what you should do is you just click on this little X and you can, push it wherever it's applicable. If you need to copy something, you can just push Control-C to make a copy and then Control-V, just like how you do all your other control and copy stuff. So that's how you kind of move that around. Here also is another little thing that you can go and copy, paste, just move it wherever it may be. So kind of fill in the blanks here. Again, here's where you put, let's say there's a 25-year-old, but then they also maybe have 50-year-old, so something like that. And male to female ratio, something could be like a 3-to-1, meaning that it's male. Now over here in the side, I kind of have all these little people, so you don't have to do this, but this is just something, I'm very visual, so I like to have visual clues. So if something was really a young patient or a baby, then you could put that there. And if it affected all ages, maybe you want to put that picture. Whatever you guys want to do, this is all about your creativity while you learn. So there you go. And then typical clinical presentation, some symptoms that they present with, prognosis, treatment options, this would be the place to put that. Any diagnostic workup, any clues on imaging that would make you think that it's this entity, pertinent labs such as, if somebody had anemia or high platelets, electrolyte imbalances, or there are tumor markers that may be elevated, hormones that can be affected here. All of that kind of goes in this section. And then macroscopic or gross examination. What to include here would just be your general overview of like what you see, what the tumor looks like, or what the disease looks like. Is it well circumscribed, or is it infiltrative? Is there some sort of characteristic color, or maybe hemorrhagic pattern, or something like that that would be a clue? Do you have any tips for grossing, especially for pathology residents? Are there things that you should really evaluate for? This is important in tumor staging. I know that when I was a first-year resident, I didn't quite understand all of the, like, how important some tumor sizes were. If it was 1.9 versus 2.1 centimeters, that would upstage a tumor and make it completely different. So just kind of things like that you should really emphasize or look for whenever you have your gross examination. So now I'm going to show you guys how to edit and add photos. Google Slides is very user-friendly. It's very easy just to drag and drop directly from your from your computer. So like here is a picture of my dog, well, one of them. So that's Tux, and then like here's a painting that I did. So put these on here. So a lot of the templates kind of have this outline where you can kind of get an idea of what to put, like make a picture, go into this area. So a way to do that is if you double click on an image, then you see that this crop box is now open. If you want it to stay in some, like rectangular thing, then you can keep it like this. So if I, just crop this and then just push enter, now that's there, I can resize it, blah, blah, blah. So then here, if I want, I know you guys have seen often how I have a circle of that. So again, if I want to make this into a circle, I double click on here, and then now I can go up here and click on this downward arrow and then choose a shape that I want to make it. So if I pick the circle, it'll automatically go like that, and then I can, like resize it by dragging up here, making it, like that. And then again, once I played around with it and made it to whatever I want, then I click enter, and then I can go down here and, resize it. Oops. Resize it, and, play around, move things, just how it's all about creativity process. So you do whatever you would like. So you can delete that. A big thing to mention here is don't forget to cite any source. If you didn't take the picture directly, or if it's not from you or anything, put that source there. It's common courtesy and kind of law to reach out and ask the person that you're going to be using. Textbooks and stuff like that sometimes is a little bit gray area, so you could just say this is from blah, blah, blah book, page, blah, blah, blah. You guys know how to reference stuff. So another one of the slides that should basically be in everything would be a histology slide with a good summary. So what I like to do is use pathpresenter.net. This is a website that opens here. They have tons of virtual slides and libraries. So let's say if I want to do breast, I can type in papilloma or whatever. Here comes inverted papilloma, search. No slides found there, so let's try if there's anything. Oh well, let me just search anything. So here's breast, has every entity of breast that they have. So let's say if I'm researching angiosarc or something, then I can click on the website, and it allows me to scroll in, and you can kind of play around. You can rotate with these, and you know, if I'm trying to show that there's increased mitoses, you can see all of these. So I kind of find whatever portion of the screen that I want. So yeah, like that was a good picture to show a lot of mitoses. And then I open this snipping tool that's on my computer, just because I have a Windows, but I know Mac, you can just take screenshots directly. But then I'll just take a screenshot, you know, drag it, whatever, puts it there. This is already directly put onto my clipboard, so it's already copied. I don't really have to do anything else further. Then I just go back to my the flashcards, and then I just paste it. So I just push paste, and then now I have this on here. So since this is a template, the things, like once you put something else new, then it goes to the top layer. So if you're doing this, then you'll have to right click on here, change this, or click on order, and then send to back. So then now it's in the back. So I can delete this. And again, you're just playing around with it. Then you can move these around. And if I want to say mitoses, I can do that. To insert an arrow or something here, line, and just point there. If I want to change line thickness, it's like that. That's too thick, then I go down. I can change the line color by clicking over here, you know, purple or whatever color you guys want. Just play around. I can edit the text down here just like how you would normally do. Anything else, I can increase the size, I can decrease the size, basically everything like that. So then if I went back to Path Presenter and I wanted to now take another picture showing, you know, that it's kind of infiltrative, again, you do the same thing where you do new and another big picture, go back to your flashcards, and then insert there. Or if I want a blank slide like here, then I insert it here. It kind of gives a better low power architectural view of what's going on. So yep, that's kind of how, like, tips and clues to doing the H&E side of putting pictures in here. I have a slide in here that's pretty good with differential diagnosis. So kind of my vision here would be if I was doing angiosarc, then I put angiosarc right here, and then I insert, you know, the image just like how that was, and then whatever my disease to over here could be like hemangioma, or like another differential would be like Kaposi's sarcoma. And then I could just get pictures of each of those and then put a couple of things that would be clue. So this would be more low grade, not as plump, endothelial cells, blah, 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 and just kind of summarize here as to how this entity would be different from these other main entities. So now to kind of show you guys how to insert slides, when I send you the template, it's basically going to come with those first couple of slides that I've already been over. To insert a new one, there's a couple ways you can do it. So one is coming up here, and if you wanted to have this same exact template, then you just click this button and it goes directly there. But if I wanted to have a different, like let's say now I have this this slide here. If I wanted to change that, I can go over here to layout, and then I have tons of layouts that I've made and kind of just go through and play with. So let's say that I really like this one, like there's 4 entities that I want to compare. Oops, normally it would change that. So yeah, here, and then I click there, and now I can go and do the same things that I was doing over here, where I add pictures, add text, I double click here and put titles, and you can just keep moving things around. I guess I'm just not wanting to change, but that's how you add that. The same thing over here is if you add or click this downward arrow and go through, you can browse and play around. There's some that have these diagrams that so you can be for good anatomic sight. Some that are more artsy looking, give you a vibe that way. Tons of layouts, so feel free to use whatever you want. If you guys come up with a new layout, feel free to share it with me, or if you have any like suggestions of things that you find yourself frequently having to change, please let me know. Just email me or probably shoot me a message on Twitter at Heart Pathology. So then I can change these to the master template or something so that everybody can kind of benefit from that. Okay, so that would be once you've finished making whatever high yield review that you're doing, just a few tips. Learning should not be boring. There's no strict rules or any one right way to create something. If you found something helpful, I'm sure there's other people that find it helpful too. So don't fear that someone's going to think that you're stupid if you post something or if you ask a question. This is not a judgmental environment, so please feel free to share everything. Learning is very collaborative, and knowledge should not be coveted. I think it should be shared freely with others. That's just my little 2 cents. But okay, back to this. Once you're done creating everything, the way to share it with myself and with others is clicking up here, this little share icon. If I click that, then next there's this get shareable link. Click here and make sure that this is anybody with the link can view it. So you can change this to where it can be, people could edit it, people can comment on it, or people can view it. So I think probably the most useful thing right now would be just to view it and then copy that link. And then I'm going to send you guys this Google Doc, but then open this Google Doc. And the way I have it set up is that there's different categories. This is where you put your high yield topic, put your name, and then the link to the Google Doc. So over here is where now just paste it into this area. And I have a bunch of different categories that you can browse through. So let's say that's cardiac or algorithms, whatever. Browse through there and then put whatever your title is here, and then your name. And if you want to put a comment, or if you notice that you're reviewing somebody else's slide and maybe there's an error or something, putting a comment here, be like, hey, there is something wrong, and then whatever. This could be where you put complete or in progress, whatever you want to do there. And then this column over here is going to be more for my purposes, just to, once I actually post it on the website, is where I'll put the link here. I haven't quite decided exactly how to do the website stuff. What I was thinking was something where it's it's like this, where you have your high yield page. So this is all dedicated to breast. And then having it to where there's, a screenshot of whatever your slide is, and then kind of having just this link. And that's like how these are too. So you can just then click on something and it'll open in the new page. My website is free, but you do have to be a member to join, just because I don't want to copyright anything. But yeah, like I said, it's free. You can join up there. So that kind of concludes how to use this document. If you guys have any questions or concerns or just want to reach out, please feel free to. Thank you so much.